AZD7789, or sabestomig, is a bispecific antibody against PD-1 and TIM-3. TIM-3 is one of the mechanisms of resistance to PD-1 and PD-L1 blockade. So it had sense to develop a drug to try to reinvigorate the T cells at the time of progression after the PD-1 and PD-L1 that we use in first-line metastatic patients. So this dose escalation, first in human study, was done in patients after a chemo and immunotherapy for stage 3B or 4 metastatic non-small cell lung cancer, any PD-L1 expression. 45 patients were enrolled, but 36 receive a biologically active dose. In terms of safety, the drug has a nice safety profile. A third of the patients develop an immune-mediated adverse event, mostly grade 1 and grade 2. There was one case of ILD grade 2. And in terms of side effects, nothing really special. 60% had the treatment-emergent adverse event, mostly fatigue, nausea, and some grade 3 decreased hemoglobin level or anemia, and one case of dyspnea related to the ILD. There was no dose-limiting toxicity, no grade 4 or grade 5, and we also showed that some of the patients had some sign of efficacy. Among the 30 patients that had the biologically active dose, 4 had a confirmed partial response, some with PD-L1 negative tumors, some EVD pretreated, some that did not respond to the previous PD-1 or PD-L1 blockade. So probably there is a role for this TIM-3 modulation in the field of PD-1 or PD-L1 blockade resistance. So the trial is still ongoing. We have expansion cohort, either in second line in these patients with secondary resistance to immunotherapy in at least 1% of PD-L1 expression on tumor cells, and another cohort in untreated metastatic patients, first line, when PD-L1 is higher than 50%.